When a patient injures their knee and they're diagnosed with a meniscal tear, the most frequent recommendation often is surgical, and the traditional method for dealing with a meniscal tear is to remove the portion of the meniscus that has been torn. The problem with this is that studies even back to the 1940s have reflected that removing a part or all of the meniscus leads to a rapid escalation of arthritis. And if you are cutting out a portion of the meniscus where it's torn, the long-term ramification is there's going to be a defect in that area that was surgically removed, and then this area will wear and tear at a faster rate, and arthritis becomes more progressive, especially if it's traumatically induced, which most of these meniscal tears are, because trauma accelerates arthritis, and then the surgery then makes a bigger defect in that area. There's actually two traumas, which multiplies the arthritic progression. So patients are now starting to look at a meniscal tear, and how can I treat this without involving surgery? So the stem cell therapy is becoming an attractive option, because if the cells can actually repair or heal that area, there won't be the defect associated with the surgical intervention, and there won't be the recovery time associated with this. Most every surgery has a period of time where there's going to be some debility, inability to ambulate freely, and avoiding exercise that might exacerbate this. So the advantage of the stem cells is there's really no downtime. You may restrict sports participation for a period of time, but there's no post-operative or post-stem cell treatment that is going to be extremely painful or debilitating. So these factors make it a much more attractive course of treatment. And if long-term you can heal without creating a defect in the meniscus by using the stem cells and regenerative therapy, then you can potentially alter the dynamics or the progression of arthritis development, which is going to be long-term favorable for a patient in their functional level, and also an athlete, in that they're going to delay or prevent early progression of arthritis. And these are all desirable events, and it makes the utilization of stem cells for knee meniscal tears a very attractive and viable option.